Foley catheter.
Indications include, but are not limited to, acute urinary retention, collection of uncontaminated urine, diagnostic studies of the lower urinary tract, monitoring of urinary output, measurement of post-void residual urine volume, irrigation of the bladder, surgery on the urinary tract or adjacent structures, bladder drainage during and after surgical procedures requiring anesthetics, and last, intermittent catheterizations for neurogenic bladder. Long-term catheterization is indicated in patients with chronic urinary retention, incontinence, and other incapacitating conditions such as Alzheimer's. While Foley catheterization is a relatively safe procedure, there are a few contraindications, including blood at the urethral meatus, known urinary obstruction, acute urethral infection, or recent surgery of the urethra. Now that we've discussed the indications and contraindications, I will take you through the procedure step by step. Before the procedure is performed, greet the patient, provide privacy, and educate. Wash your hands and ensure that the patient is comfortable. Now it's time to gather your equipment for the procedure. The Foley catheter is a straight, self-retaining catheter that may have 2 or 3 lumina. While urine flows through the main large lumen, the secondary smaller lumen is connected to a small port used to inflate the retaining balloon. A Foley with a third lumen may be selected if irrigation is necessary. Foley catheters are made of both rubber and silicone. If the patient is sensitive or allergic to latex, replace the catheter in the kit with a silicone catheter. Now that we've reviewed all necessary equipment, we can now go over the procedure step by step. Place the patient in the supine position with the legs abducted. This is otherwise known as the dorsal lithotomy position. Position the sterile fenestrated drape around the patient's genitalia at this time. Remember to use strict sterile technique for the insertion process. Now would be an appropriate time to put your gloves on. Remember, these are sterile. Using your non-dominant hand, use lateral and outward traction on the labia in order to identify the urethral meatus. Cleanse the urethral meatus and surrounding area with antiseptic solution. Grasp one cotton ball with the forceps, wipe one side of the labia from top to bottom, and discard the cotton ball away from the sterile field. Repeat on the opposite side and in the middle using the third cotton ball. Then wipe the area dry with the dry cotton balls. If anesthetic jelly is to be used, now would be the proper time to insert the lubricant into the urethra with a syringe. You may instead choose to cover the tip of the catheter with the lubricating jelly rather than physically injecting it. With your dominant and still sterile hand, take the catheter and insert into the urethral meatus. Advance approximately 3 inches. Wait to see if urine flows, and then advance another inch before inflating the balloon. Now inflate the balloon with approximately 5 milliliters of normal saline or water. The catheter is now gently pulled outward until the balloon rests against the bladder neck, which may be felt as resistance. Once in place, the catheter should be secured to the leg with tape or other means to prevent trauma to the urethra. Congratulations! You have now successfully inserted your first Foley catheter. Indwelling catheters can be managed by cleaning the perineal area and catheter tubing proximal to distal with cleanser or cleanser wipes every day and after every bowel movement. Catheters should be replaced every 6 weeks or sooner when used long-term. Consider antibiotic prophylaxis in the long-term patient to avoid infection. The catheter may be cleaned as often as every 6 hours, and the Foley bag should be emptied every 8 hours or when the drainage bag is approximately 2/3 full. Be on the lookout for possible signs of complication, including urinary tract infection, urethral injury, skin breakdown, bladder stones, and hematuria, or blood in the urine. You have now learned all necessary components of inserting the Foley catheter. Good luck, and thank you for watching my video.